Welcome to today's Medicare 360 show. How's everyone doing on this Monday? Hopefully fine and well. Let's get started with the Medicare New Handbook. We are on our series 2 on this, and we are starting on page 13. So getting started with Medicare. So make sure first, before you get started with Medicare, is you understand your Medicare coverage options. There are two main ways to get your Medicare coverage. That's your original Medicare, Part A, hospital, Part B, medical, and Medicare Advantage, which is Part C. Medicare Advantage is Part A, hospital, Part B, medical, most of the time Part D, drugs, to equal Part C, A, B, and D. Don't let these call center agents confuse you because you probably may have it and they always like to confuse people. So we did compare that on pages 10 to 12. Learning more about that, watch the episode before this one. So how do you find out when you can sign up for Medicare? If you don't have Medicare Part A or B, go to page 15. If you don't have Medicare Drug Coverage Part D, go to page 79. So now how Medicare works with other insurance, if you have it, go to pages 19 to 22. Review your Medicare health and drug coverage each year. Make sure it still meets your needs and decide if you want to make a change. You don't need to sign up for Medicare each year, but you still should review your options. So I do recommend this, especially for your drug portion, because drugs change every single year, the formulary, the tiers, and the pricing, and you just don't want to be surprised or shocked that your drug isn't covered, you have to pay a deductible, or it's just costing way more than you had expected. So keep that in mind. So mark your calendar with these dates. So January 1st, 2025, new coverage begins if you did make a change. So that change was from October 15th to December 7th. And it'll have that effective date of January 1st. From October 1st to October 14th, you can start reviewing your plan, but you cannot enroll until October 15th for a January 1st effective date. So on January 1st to March 31st, if you are on a Medicare Advantage plan, you could change to a different Medicare Advantage plan or switch back to original Medicare and join a separate drug plan once during this time. So these are for those that, let's just say you're on vacation, you forgot, didn't have time to do it and review your plan. You can definitely still change your plan from January 1st to March 31st. You can make that change and then it'll be effective the first day of the month. So let's say you talk to an agent in January, February 1st is the effective date. In February, it would be March, and March, the last day, March 31st, it's an April 1st effective date. Keep that in mind. And like I mentioned, October 1st, you could start comparing your current Medicare health or drug coverage for, say, the 2026 year to help you save money or get extra benefits. And also because plans do change every single year. It could be a quick call, 5-minute call with your agent to make sure everything is good and nothing's changed, but definitely do that every single year. And I already mentioned October 15th to December 7th again. You could definitely change again and switch. So important, you may pay more if you don't sign up for Medicare when you're first eligible. We already kind of talked over that, and we'll go on that on page 22 to 23, Part A and B, and page 83 for Part D, late enrollment penalties. So those are the biggest things that you don't want to be caught not having a plan because you will get penalized. Let's go to page 14, get help finding the right coverage for you. Explore your options. You definitely could go to medicare.gov/plan-compare to find and complete health and drug plans. clients of mine do go on here. They want to do their own research. They like the little DIY, right? Do it yourself. However, they do come to me to consult because I do this every day. And so the ins and outs of the different plans, the vendors, just the ratings, the reviews, if your doctors are in the network, if they're out of the network, and if all your doctors and specialists align to the network. It is confusing. It doesn't show it there. So there's a little bit more due diligence on that. You can go get free personalized and unbiased health insurance counseling from a state health insurance assistant program, SHIP, which is on pages 114 to 117. But I mean, these people are not licensed. They're not certified. They're not certified every single year, and they don't certify for each insurance company. So they're volunteers. While it'd be great, yes, they're unbiased, they might not know the ins and outs to help you. It's just like calling Medicare and Social Security, and some clients have gotten wrong information. So do your due diligence. I strongly suggest a trusted agent or broker. Give me a call, could help you. And there are rules to us. We just can't call you cold call. And that's why those unscrupulous telecenter agents, they're not even maybe from here and overseas. You're getting those calls and you're really not supposed to unless you requested that information. Get help paying for healthcare. There are multiple programs to help with costs. Many people with Medicare qualify for. That's page 91 to 96. And then go digital. You could help Medicare save money by switching to the electronic version of this handbook. I do like the paper copy, but you can definitely order it or give me a call and we could order it for you. We could also email that too. As of late 2024, people who signed up for the electronic handbook helped save the Medicare program close to 26 million. That's pretty crazy. So with that being, that is probably really important to just get it on print, soft copy versus hard copy on that. Okay, so section 1, page 15, signing up for Medicare. Will I get Part A and B automatically? So there's caveats to that. If you're already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically get Part A and B starting the first day of the month you turn 65. If your birthday is on the first day of the month, Part A and B starts the first day of the prior month. I actually had this happen. I had a client whose birthday his birthday was March 1st. I met them a week before March 1st. We went online, got that taken care of, applied for Medicare. A couple days later, he got his Medicare number, and voila, it was March 1st. I'm sorry. His birthday was April 1st. So he got his Medicare March 1st. So you could actually get your Medicare quickly if there are no hiccups. And this case was a really great example of no hiccups. I asked them to create a user and ID password on ssa.gov, went to their house, asked them to sign on. We went through it together, submitted it. Wow. A few days later, he did get his number. So it could be very fast as well. So keep in mind, when you are on Social Security already, you should get your Medicare card within about 3 months. I've seen it even sooner at 4 months. So make sure that you check your mail that you got that card if you are already on Social Security. Today, I think I'm going really fast. I've had 2 cups of coffee already and I've been up since 3 a.m. So let me just slow down a little bit. I get really excited about Medicare. Okay, so if you're under 65 and have a disability, You'll also get Part A and B automatically after getting 24 months of disability benefits, either from Social Security or certain disability benefits from the Railroad Retirement Board, RRB. So this has happened recently too. I met a client at my office. Her birthday was, I believe, September. However, she's like, I got my Medicare card already. And I said, are you on Social Security Disability SSDI? And she was. So 2 months, 2 years, sorry, 2 years from the date you started, you will get your Medicare. So she has her initial enrollment period for Medicare. Also, when her birthday comes, that's also another type of enrollment period. If you do live in Puerto Rico, you don't get Part B automatically. You do have to sign up for it. So page 16 on that. If you have ALS, amyotrophic lateral sclerosis, called Lou Gehrig's disease, you'll get Part A and B automatically the month Social Security disability begins. Okay. If you get Medicare automatically, you'll get your red, white, and blue card, Medicare card, in the mail about 3 months before your 65th birthday or 25th month of disability benefits. You don't need to pay a premium for Part A, sometimes premium-free Part A. And then most people do choose to keep Part B. If you don't want Part B, let us know before the coverage start date on your Medicare card. If you do nothing, you will keep Part B and pay Part B premiums through your Social Security or RRB benefits. If you have other coverage and need help deciding if you should keep Part B, go to page 19. So that's the biggest thing. Sometimes people don't know that they could return Part B if they don't need it. The reasons for returning Part B is, say you're on a spousal's group plan and your benefits and the premiums you pay are definitely lower. That might be something, looking at your deductibles, co-pays, co-insurance, max out-of-pockets, network, surgeries and prescription drugs. What else? There are other reasons why you may not want to get on Medicare Part B. However, if you are on individual insurance, no insurance at all, Medi-Cal, or just any insurance that is not credible, such as the VA portion, please keep your Medicare. Because if you do choose not to keep Part B, but you decide you want it later, you may have a delay in getting Medicare Part B coverage because you could only sign up at certain times. You may also have to pay a late enrollment penalty for as long as you have Part B. So that's page 23. Will I have to sign up for Medicare Part A and or B? Well, if you're close to 65 but not getting Social Security or RRB benefits, you'll need to sign up for Medicare. Visit ssa.gov/Medicare to apply for Part A and B. And as a service, we do this for our clients. You could also contact Social Security 3 months before you turn 65 to set up an appointment. And if you work at the railroad, you could visit rrb.gov. In most cases, if you don't sign up for Part B when you're first eligible, you may have a delay in getting Medicare B coverage in the future because you could only sign up at certain times. You may also have to pay a late enrollment penalty for as long as you have Part B. Go to page 23. Note pages 119 to 122, definitions for the blue words. Okay, I hope you're following along. So page 16, if you have end-stage renal disease, ESRD, and want Medicare, you'll need to sign up for it. Contact Social Security to find out when and how to sign up for Part A and B. For more information, go to the Medicare.gov publications to review the booklet. Medicare coverage of kidney dialysis and kidney transplant services. So important, if you do live in Puerto Rico and get benefits from Social Security or the railroad Retirement Board, RRB, you'll get a Part A automatically starting on the first day of the month you turn 65 or after you get disability benefits for 24 months. However, if you want Part B, you'll need to sign up for it by completing an application for enrollment in Part B CMS 40B. To get this form in English and Spanish, you could visit the publications on Medicare.gov or call the 1-800-Medicare number to have a copy mailed to you. So if you don't sign up for Part B when you're first eligible, you may have to delay and getting Part B coverage in the future because you could only sign up at certain times. You may also have to pay a late enrollment penalty for as long as you have Part B. So go to page 23. So keep in mind, if you do not want to get your Part B or give it back when the time comes, you can enroll in Part B with this form called CMS 40B. There is another form that you do have to give your employer or all the employers that were from age 65 to when you want your Part B, so you could show proof that you had credible coverage. So where can you get information? Of course, from me, but you could also visit ssa.gov/Medicare/sign-up for more information about your Medicare eligibility and to sign up for Part A and or B if you don't get them automatically. If you work for a railroad or get RRB, you could visit RRB. This is a little bit redundant, guys, but I'm just wanting to read this with you guys and just learn about Medicare and the whole thing this year. So you could also get a free, personalized, and unbiased health insurance counseling for your state health assistance program. So go to pages 114 to 117. I want to look into SHIP and see how much hours or how much certification have they had to actually help people with their Medicare. I mean, this is about penalties. So I'm just not seeing how someone that's volunteering could really understand the ins and outs of Medicare like a agent or a broker does. So after you signed up for Medicare Part A and or B, it's time to look at your coverage options. People get Medicare coverage in different ways. To get the most out of your coverage, review all your options and decide what's best suits your needs. Go to page 11 to 13 for more details. So that's the biggest thing. You just don't stop when you get your red, white, and blue card. Know that that's original Medicare. And if you're not on Medicaid or Medi-Cal in California, there's going to be a lot of out-of-pocket costs if you don't get a plan to go with it. And remember, there is a Part D looming in there that you do need a Part D as well. So that's when I come to play and my team come to play to help you, provide you all the options that you have at that time. So call me once you get that red, white, and blue card. If I didn't get Part A and B automatically, when can I sign up? If you didn't get premium Part A automatically, for example, benefits because you're still working and not yet getting Social Security or RRB benefits, you can sign up for it at any time after you're first eligible for Medicare. So go to page 22. In this example, your Part A coverage will go back retroactively 6 months from when you signed up for Part A or applied for Social Security or RRB benefits, but no earlier than the first month you're first eligible for Medicare. Depending on how you become eligible for Part A, the retroactive period may be different. You could sign up for Part B during the enrollment period shown on page 17 to 18. Okay. So this is saying that Part A coverage will go back 6 months from when you signed up for Part A or applied for Social Security benefits. So like you apply for Social Security, so technically Part A would be 6 months before that. So that comes important when you have a health savings account, because you're not supposed to have a health savings account if you have any parts of Medicare Part A or B. It's not that you would get penalized. It's just those tax credits or tax deductions that you got from that, you would have to pay it back. Okay, let's see if we have some more time to do one more page. So page 17, important. Remember, in most cases, if you don't sign up for Part A, you have to buy it. And Part B, when you're first eligible, your enrollment might be delayed and you may have to pay a late enrollment penalty. That's pages 22 to 23. So you can apply for Part A even though you don't have the 40 credits or the 10 years. If your spouse worked for that, you could use theirs, or you could just work a little bit more so you don't have to pay that. What are the Part A and Part B enrollment periods? You could only sign up for Part B and or A if you have to buy it during these enrollment periods. Okay, so let's going through the enrollment periods. Initial enrollment period, generally, you could first sign up for Part A and or B during the 7th month period that begins 3 months before the month you turn 65 and 3 months after the month you turn 65. If your birthday is on the 1st of the month, your 7th month period starts 4 months before the month you turn 65 and ends 2 months after the month you turn 65. So that's really good to know. Because that 4 months is because you have that one extra month in the beginning, and then they're not going to give you one more extra month on the back end. So keep that in mind. So if you turn 65 on June 2nd, your 7th month period would begin in March and end in September. But if you turn 65 on June 1st, your 7th month period would begin in February and end in August. If you sign up for Part A and or B during the first 3 months of your initial enrollment period, in most cases, your coverage begins the first day of your birthday month. However, if your birthday is on the first day of the month, your coverage starts the first day of the prior month. If you sign up the month you turn 65 or during the last 3 months of your initial enrollment period, your coverage starts the first day of the month after you sign up. So keep that in mind. If you want to start your birthday month, then apply beforehand. And if you want to start, say, after your birthday month and you want a specific month, apply prior to that month. Special enrollment period. After your initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. For example, if you didn't sign up for Part B or Part A, if you have to buy it when you're first eligible because you have a group health plan coverage based on current employment, which is your own or your spouse's or a family member if you have a disability. You could sign up for Part A and or B anytime you're still covered by a group health plan. So keep that in mind. You could transfer anytime. And during the 8th month period, that begins the month after the employment ends or the coverage ends, whichever happens first. But I wouldn't wait till that 8th month period. Please get coverage once your coverage ends and plan for it, I would say 3 months before. Your coverage generally starts the first day of the month after you sign up if you sign up for Part B while you're still working or within the first full month after losing employer coverage. You can request to delay your Part B start date up to 3 months. Usually, you won't have to pay for a late enrollment penalty if you sign up during a special enrollment period. This special enrollment period doesn't apply if you're eligible for Medicare-based end-stage renal disease, ESRD, or you're still in your initial enrollment period. So to sign up for Medicare, Part A and or B, visit ssa.gov/Medicare/sign-up, or definitely give us a call as we are able to help assist with you this process, and we are a resource to the community. So this concludes our Medicare New Handbook episode 2. Next week, we will touch on more on signing up on Medicare, page 18. Till next time, you have a wonderful week. I will see you next week. Thank you.